So starting with adrenal insufficiency, it can be divided into primary, secondary, and tertiary. Okay, coming to primary. In primary, what happens? All three layers are affected. Okay, now if all three layers are affected, then you will have decreased aldosterone, decreased cortisol. Okay, and your androgens will be decreased. Okay, so now that all your this is increased, so what will happen is that if your there is decrease in cortisol, decreased aldosterone, and because of this the negative feedback is lost, so that's why you get an increase in ACTH. Okay, now what, when your cortisol is decreased, you get complaints like fatigue, PSY, manifestations like decreased mood or depression. All right, and aldosterone, when aldosterone is low, you get increased potassium and decreased BP, blood pressure is decreased, and acidosis, because you know aldosterone, what aldosterone does is it normally what it does is in the urine, suppose this is the urine, it causes potassium to this, absorption of sodium, loss of H plus and bicarb. It's normally, so when this is lost, you get all of these symptoms, right? Then you also get because of ACTH, there is increase in melanin production because of MSH hormone, and that is why these patients present with hyperpigmentation, which is a kind of high yield clue to know. All right, and also because of decreased androgens, you get decreased libido and decreased secondary sexual characteristics like decreased body hair. But all of this is only seen in females, because males testis produces, or you can say, yeah, produces androgens required for them. Okay, now this is also, it can be due to not forget due to, how do you diagnose these? Okay, so you do 8 a.m. cortisol, okay, and plasma ACTH levels. Cortisol, if it is less than 5 or minimally normal or minimally reduced, okay, and your ACTH, it will be increased. All right, this is your first test, and then your second test is cosyntropin test. Okay, in this what happens, cosyntropin is actually a synthetic ACTH. All right, so what it does is that this, so there will be no increase in cortisol levels after cosyntropin is given. All right, and then it's most commonly seen with other autoimmune conditions like you can say diabetes type 1, primary hypothyroidism, vitiligo. So you have to remember these also in making the diagnosis. All right, then comes the other autoimmune conditions, or with miliary TB in developing countries, right? So now when you come for the treatment, you give, because your cortisol is low, you need to replace aldosterone. So cortisol, you give hydrocort or prednisolone, and for aldosterone treatment you give mineralocorticoids like fludrocortisone. I hope that's clear for primary. All right, now coming to your secondary, what happens, it is due to pituitary cause, and tertiary is because of a hypothalamic cause. Okay, so this there will be reduced ACTH, and there will be in this corticotropin releasing hormone, and also this happens when you abrupt cessation of steroids. Okay, so in this what you see is there will be reduced cortisol, okay, normal aldosterone, because it is also regulated by the kidneys. Okay, and you will see a decreased ACTH. Okay, decreased, and there will be no hyperpigmentation. and normal potassium levels. Okay, so how will you differentiate between the two? And also coming to treatment here, because your aldosterone is normal, you only need glucocorticoids, which are hydrochlorothiazide. This has dual, but this one. Okay, and then now how will you differentiate between the two of these? So you must remember is that one is that there is hyperpigmentation. Okay, and remember that there is no hyperpigmentation here. You have normal potassium and you have increased potassium. Okay, you have normal aldosterone and here you have decreased aldosterone. All right, now coming to things called acute adrenal insufficiency or Addisonian crisis. This is a increased stress state, okay, in patients with adrenal insufficiency or on steroids. So how did they present with? They present with shock, ABT, abdomen pain, nausea. All right, and the treatment here you give is rapid intravascular volume repletion plus glucocorticoid. It's like hydrocort. Okay, then you have something called as